The 20th Annual Board of Healthcare Funders Conference will be held on the 21st of this month, and of course it intends to deal with heart-pressing issues of the health sector. South Africa is grappling with the implementation of the National Health Insurance Policy while it's still addressing challenges of primary health care. Their theme is Convergence 2030, Healthcare Reimagined. But how will healthcare be reimagined while the cost of medical care keeps on being high and, of course, the poor not being able to afford it while medical aid schemes have to keep up with inflationary costs? Well, as different stakeholders meet at the International Convention Center in Cape Town, will they be able to address these issues and bring about solutions? Let's ask Dr. Katlego Mothudi, who is Managing Director of the Board of Healthcare Funders of South Africa. Sir, thank you very much for coming.
Thank you very much, Colin.
What is the objective of this conference?
The BHF is looking at bringing together the various sectors to start having the dialogue on reducing fragmentation of the health systems. We're not just looking at South Africa, but also the other participating countries within SADC, because the challenges that we face as the various countries are very, very similar. We have all embarked on this route to try and achieve universal health coverage by 2030. And we want to look at the steps that all the countries in the member associations have started to achieve toward that.
But if you want to achieve that in such a long haul, are there signs that you could be getting there? I'll tell you why I'm asking you this question. When we look at primary health care, people complain about how public hospitals treat patients. We look at the issue of safety of nurses. You look at the overworked doctors, shortage of them, some of them not even wanting to go to work in rural areas. With these kind of problems, how are you going to achieve that?
I think the first thing is we have to stop looking at our health sector as a binary model. At the moment, you've got a public health system struggling, a private health sector which is also struggling under increasing costs. So we must start this convergence of saying, as a country, as a region, we should really look at implementing one healthcare systems. The guidance is already there. If you look at what the WHO says about establishing health systems, there are certain pillars that are important. Issues around leadership and governance. We know that as South Africa we are struggling to a large extent around that. Healthcare financing systems, infrastructure, health resources, you've mentioned some of the challenges. So we cannot isolate issues and say private sector is struggling with cost only or the public sector is struggling with quality. We need to look at healthcare reform in its totality.
But right now they exist in the parallel, and the private healthcare sector may be actually wary of the issue of cost containment, the cost of hospitalization, consulting fees and medication. Prices keep on going high. And also you'll remember that your sector is experiencing a problem regarding collusion in as far as medication is concerned. You remember the Competition Commission also found out that pharmaceutical companies were colluding in terms of pricing of, for example, cancer medication.
Yeah, that is true. And I think we have to accept that we have an ailing system. And I think there's a first big track. Then we have to look at other countries in terms of what steps have they done. We'll be having speakers from Asia, other areas in Africa to give us their own experiences. What is true is that we need to focus on an integrated patient-centric model, and by that I mean that we need to start tracking the services that are given to the patient based on their needs. We have already started that now because the government has tabled the National Health Insurance Bill, and we have to support that process to make sure that we align both sectors.
Will the total number of problems that both health sectors have bring about the total number of solutions that they have? Let's paint an example. If the private sector has high cost containment issues, will it compromise the prices? And on the other side, public healthcare system, will they up their game in terms of quality service?
If we look at both sectors, I would say there are pockets of excellence. And unfortunately, they are kept separate because there's no deliberate collaboration between the sectors. Now, we have to take guidance from those systems that have already started to converge. And I'll give an example in terms of the human resources, for example. The BHF released a report middle of last year that looked at the demographics of healthcare practitioners. On the private side, we've got almost an oversupply. The government has said for their norms and standard that there should be at least around 3.5 healthcare practitioners per 10,000 population. In the private sector, we've got an oversupply of about 15 per 10,000. The public sector has got about 2. But if you had to look at the combined figures, it is closer to what the government would want. So if we deal with them in a similar fashion, where each sector seeks its own solutions, we'll never get closer to where we need to be.
Are we going to see a scenario where patients are turned away and give birth right on the stoop of a hospital?
And that is very wrong, and we condemn that in a strong possible way, and that should never happen. We are not saying that there won't be any rationing in a new system because resources are scarce, but we want a system that patients will be dealt with humanely, and make sure that not just the patients, but also the healthcare givers, their needs should also be addressed, because some of them, they could give maybe understandable reasons about the pressures that they work under. But if we do not seek those solutions as far as the two systems coming together, otherwise we will not find a solution that will be favorable.
All right. Thank you very much for making time to speak to us.
Thank you, Colin.
Okay. We are speaking here to Dr. Katlego Mothudi, who is Managing Director of the Board of Healthcare Funders of Southern Africa.